Okay, so this is Lisa again, video number 3 um, about upper jaw surgery that I will be having on December 5th, which is a couple weeks away. In my last video, I showed you my splint, and I talked about wearing the splint and the importance of deprogramming the muscles of the jaw, especially the masseter and the pterygoids, and I talked a little bit about the SCM, which is a big name called sternocleidomastoid. So there's a lot of muscles in the neck, and of course all of that's connected to the rest of your body, and your temporalis and your occipitalis and your frontalis, and I could go on and on about all the muscles that are involved, even around the face and up in here with your jaw, especially your jaw. So when I first started out trying to figure out how to treat the problem, once my problem was diagnosed, I was sent to a physical therapist by the first TMJ specialist, and he was really good. He worked on inside of my mouth with like a stick, and was trying to, kind of loosen up the muscles. And basically when my muscles were so tight, they were trying to like open up the muscles so that blood flow could get in and the muscle could release, and so on and so forth. So I did do physical therapy for, I can't remember, for a little while, for a couple of months or something. And it just didn't seem right to me, because they would just be working on my jaw muscles. And so I thought to myself, well, that doesn't make any sense. I did mention before that I have a degree. I have a degree in physical education, and I minored in exercise physiology. So I think that because of the knowledge that I have of the muscles of the body and the connection of the body, I really was kind of like dumbfounded. I didn't understand why they were working so much on one part of my body and they weren't working on my whole body. And so, because your jaws are connected to your whole body. So I started doing a lot of research on like whole body dentistry and the connection the jaw has with the rest of your neck. And I just started doing a lot of research, and because I knew that I needed something else, because my muscles were a mess. Not everybody's like me. Not everybody's muscles are as crazy as mine were, because my natural bite was so open, and then everything obviously shifted so much. So I just knew in my mind that I needed something more. So in my research, I kind of stumbled upon what is called rolfing, which is ROLFING. I say stumbled upon because I actually really wasn't looking for anything at the time when I found rolfing, except for guidance with having a second baby, because I was still, and I had no braces at this time. I was just in splint therapy the first time. This is many, many, many years ago. So I stumbled upon rolfing because I went to a place that did prenatal care, and they also did chiropractic care, and they also did massage therapy. And I just kind of got lucky, and they were like, they kind of reverted me or redirected me to the other department, because I was in so much pain. And they were like, well, you need to be out of pain before you have a baby. So I did research on rolfing. I never heard of it, or it's called structural integration as well. Basically, it's similar to myofascial release. It is myofascial release. It works with the fascia in your whole body, and in the connection between your head, your shoulders, and your pelvis, and basically your whole body. So it's very expensive. TMJ therapy is also very expensive. My initial visit with the TMJ specialist was $500 the first time, so not covered by insurance. So all of this that I'm doing is very expensive to do. A lot of people just don't do it. They don't have the time, they don't have the money, they don't have the patience. It's very, very difficult, and it's painful. So I was lucky enough to stumble upon rolfing and structural integration, and I knew at that point, I was like, oh my gosh, this is exactly what I need. My body needs this. I was in splint therapy the first time, hadn't had braces yet at all, so we're very, very early on in my treatment. As I'm talking to you, it was a long time ago, and so Google it, research it. It's the most amazing thing that that's ever happened to me. I was completely integrated before I had the first braces on. I wanted to free up as much of the restrictions in my body as possible before I had braces. The first time, the only problem was is that at that time I didn't know I had a skeletal deformity, and no one did. So, but the structural integration released so much muscle tension in my body that a lot of my pain just kind of went away. And so I continued with some myofascial release sessions during the first time I had braces to try to keep my muscles relaxed, but my muscles would just always tense back up. And I didn't know why. I would release them. I would have someone release them. I would learn how to release them myself. I would work on my body at home. And then I was in braces at the time. So I was not in splint therapy during braces the first time. I was just in braces to fix the bite. And I was just kind of like, what is happening? Why are my muscles, just going back into spasm? But I continued with the myofascial release. It helps out so much while you're going through this process of trying to figure out what's wrong with your body. So I recommend that highly if if you have any TMJ problems or you're going to have splint therapy, to try to get your jaws back to where they were or where they're supposed to be and where they function best. I recommend myofascial release. I got lucky enough to be with a great therapist. It's 15 sessions, and the sessions are done or 10 to 15 sessions, depending on the rolfer or the integrationist, of myofascial release. And they work to balance your entire body. It is painful. If your muscles are tight and in spasm, it's painful. It is so painful. But then you feel released. You almost feel like you're unplugged, and you didn't know that you were so tight until they start working on your body. So I did that, and I continued to do it through the first time I had braces. But of course, I had a skeletal deformity, so my lower jaw was still trying to figure out where to go, and of course that's going to mess with this. I never really had any more problems with my lower body. It all starts in here with me, or started in here after the braces came off, and I went to the other TMJ specialist and was put back in a upper splint for 3 years. I think I've already told you that. I continued with myofascial release. I had tune-up sessions done to my body because your jaw's moving, and when your jaw shifts and these muscles start to heal, or your jaw joint starts to heal as well, and these muscles start to relax, you've got tense muscles here and here and here, and they don't know what to do. They're like, what? I've been connected this way for so long, and now you're moving. So it's real important to continue. I thought, you know what? I'm just going to continue to help these muscles to connect with these muscles as they move. So, because it's all connected. I felt very strongly about that. Now, I never said anything to my TMJ. All I did was say, hey, can I do massage therapy? And he was like, sure. Some TMJ specialists will put the TENS unit on you, but they only put it on here, here, and here. And that just didn't make sense to me. There's so many other muscles it's all connected. I think that you should look at your situation as a whole body. It's a whole body problem. When one of your jaws is not lining up with the other, it's going to affect your neck, it's going to affect your upper back and your lower back, and that's just going to affect everything. So my message is really to get out is to research the muscles of the body and to research structural integration or myofascial release. It's expensive, but learn it. When you go to a session, what I would do is I would actually learn by paying attention to what they were doing to me. And I've taken that and I've used it on my children. I've used the myofascial release on my husband, myself, in order to help free them up, because it's necessary. I think of it like flossing your teeth or going to the dentist. I think that that we use our bodies wrong, and and we have habitual muscle tension going on, a lot of it, and I think it's important to be aware of that, um, and uh, and do it on a regular basis if you can. If you can't afford it, then do it to yourself. You know, get the trigger point therapy workbook. Oh my God, it's like my Bible. Uh, they're basically trigger points or myofascial points or whatever. They're knots in your muscles, and try to do it yourself. It is more difficult to do it on yourself. It's better to go have sessions done for yourself, but because they're really good at what they do, with balancing your body. So I feel like that's really helped me to get to the point where I'm hitting centric relation, because you have to, those muscles have to release, and then you got to let go of it. And that is another therapy that I learned about, called the Alexander technique, and that actually goes along with Rolfing or structural integration. And basically it tries to get you to realize that you're holding patterns in your body, and not just in your jaw. Obviously, we're talking about jaw surgery, so it's going to focus on that, but in any part of your body, you're holding patterns. When they release a muscle, say in your jaw, and they release a part of the masseter muscle, and you don't let go of it, then it's going to stay tight. So you have the Alexander technique. I took a couple of those classes. That really helped me to let go of the holding patterns. Once my muscles were able to heal and release, and my jaw joints were able to heal, I had to let go. And that took time too. And that took awareness, and a lot of reading, and a lot of just practice, for me to let go of where my jaw had been my whole life. You could free it all up, and then if you're still holding it there, it's all freed up, and you don't let go of it and let it go where it wants to go, then it's your muscles are just going to tighten up again. So if that made any sense at all, hopefully it helped somebody. That is my explanation of alternative therapies, I think, that are great to use before you are having jaw surgery. Cranial sacral work is also great, and acupuncture is also great. All of those things are just working to help you release. Alexander technique is phenomenal to help you to let go of holding patterns. And that's my video on massage therapy and how much it's helped me, and my children and my husband. Of course, when I work on them, it's for free. So, other than that, in my next video, I will talk to you about my surgery, because it's coming up, and I will talk to you more about like what they're going to do and how they're going to fix this, and surgical molds, and all of that stuff. Okay, so I hope that helped. All right, bye.